Hello, everyone. Today I'm going to talk to you about my public health organization called Rise Above the Zika virus, raising awareness, providing prevention. In 2015 in Brazil, there were 2,782 suspected cases of microcephaly, which gained wide media attention and brought Zika virus to the mainstream attention. Evidence in the New England Journal of Medicine later showed an increase in Guillain-Barré syndrome, as well as a number of babies born with microcephaly that coincided with Zika virus infections. Though a lot was understood about the Zika virus, we learned quite a bit more during this crisis. 1 out of 4 infected people develop symptoms of the disease. Among those infected, the disease is mild and can last 2 to 7 days. What's of particular importance is for pregnant women who could potentially contract the disease, that they would not travel to areas of ongoing Zika virus outbreaks, as well as sexual partners of pregnant women who would be capable of transmitting the disease through intercourse as well as through other blood transfusions. Once more was understood about the Zika virus, as well as spreading and symptoms were publicized to the public. How it spreads, symptoms, non-symptoms, and treatment were important to get into the public eye, but the main message that needed to be stressed was to seek out an infectious disease doctor to get a proper diagnosis, and to allow, if in the event that a pregnant woman did contract the Zika virus, that the pregnancy could be monitored. I wanted to highlight some of the organizational values about Rise Above. In particular, we believe that that everyone should have access to accurate and up-to-date information about any Zika virus epidemic. We also believe everyone should have access to diagnostic services so that healthcare professionals can receive the resources to properly identify the symptoms of the Zika virus. And by using a cohesive network of physicians, nurses, transportation companies, and politicians across all nations, we can quickly identify and isolate Zika virus infections. This speaks to the tagline, raising awareness, providing prevention, which Rise Above seeks to do. This is embodied in the mission statement, where the Rise Above organization is committed to saving lives, the prevention and containment of Zika virus outbreaks through education, research, policy advocacy, by using a united network of healthcare professionals, volunteers, and political figures. The vision for Rise Above as an organization is to ultimately prepare the world for future outbreaks through education, research, and policy advocacy. Rise Above has several goals that they hope to achieve in the form of SMART objectives, the main goals being reducing the rate of mother-to-child transmission of the Zika virus globally, as well as raising awareness about how the Zika virus spreads and how symptoms manifest. There's a 3-pronged approach to this through prevention, detection, and response. Prevention would involve controlling any vectors by working actively with national authorities. Detection would entail building the capacities of different laboratories to detect the virus in a timely fashion, as well as to monitor with other international health regulatory authorities and survey the emergence of new complications. Response would involve preparing and recommending how to care in a clinical setting, as well as advising on risk communications and helping countries to buy the necessary resources, be they lab supplies and diagnostics or insecticides and larvicides. So essentially, the Rise Above organization will play a support function to, as the Zika virus falls out of the public eye, to prepare in the event that another outbreak were to come. Thank you for your time.